Welcome back. We're here at New London Hospital, and joining me now is their medical director, Dr. James Murphy. Thanks for joining us.
Oh, thank you for joining us once again.
Well, great to talk to you. You've just come through the Community Needs Assessment, something that's done every 3 years.
Yes.
And you found out some great things that you're now passing on to our community.
Yeah, and most folks don't realize, but we have what is called a Community Needs Assessment. And really what it is it's the hospital, which virtually all hospitals have to do anyway, as a requirement, but it's a really great tool for us to reach out to the community to identify what their needs are. What are we doing well? Why aren't we doing so well? And what is it they need that we could bring on that would allow them to have their care done locally versus going up to DH, to the Tertiary Care Medical Center or elsewhere?
Sure.
And we came up with a number of different what we expected findings, but sometimes unusual findings that kind of rose up to a level of concern that made us take action. So one of them has always been and continues to be primary care. For various reasons across the region and the country, primary care provider numbers are going down. And it's partly because of the reimbursement issues that we all know about, but also the number of trainees coming out are going down as well.
Yeah.
So we realized that primary care access, and that includes internal medicine, family practice, pediatrics, women's health, all of these providers were at one point, limited in their availabilities here at New London Hospital. I can confidently tell you right now, we are probably as well staffed with primary care in all the specialties I mentioned as any community hospital across the region. As a result of that, we now have, I would say, access for patients that not only are in our own panels, but those patients that move to the area, come to the area, and are looking for a new primary care provider. So I think right now we have tremendous access in primary care. Having said that, one of the other things we always hear about is, you hear about a lot of different things in a community needs assessment, but one of the things that rose to the top of concern, and we all know about the drug crisis in New Hampshire and across the country, but a more generalized concern was of stress in a lot of the patients across the region.
Yes.
And as a result of that, what we were able to do, and blessed to be able to do, is we were able to hire a wonderful psychiatrist with many years of experience, an old friend of mine from residency at Dartmouth, Benita Walton, Dr. Benita Walton, who is a psychiatrist who works now both at New London Hospital and at Newport Health Center. Great. And immediately, as expected, she is seeing a lot of folks, giving great care, working collaboratively, again, with our primary care providers, which has been a tremendous asset, I think, to the community and to our region and to our hospital.
Yes.
And again, to our primary care, because they work so closely together managing these patients.
Absolutely.
Yes.
Good. Well, that's a big hole that needs to be filled.
It is a
really,
big hole that needs to be filled.
Psychiatric.
And though the community needs assessment doesn't necessarily address specific specialties, I would first give a shout out to the fact that at New London Hospital, we now offer probably, I would think, in a community hospital in New Hampshire, one of the broadest spectrum of specialists that we have, not only a part of our own employed providers, but also in collaboration with Dartmouth. For instance, we have nearly 20 what they call PSA, professional service arrangements, with Dartmouth, and it includes everything from general surgery and orthopedics to ENT surgeons, to GI or gastrointestinal, to oncology and pain management. So we offer a broad spectrum of providers here that work both at DH and down at New London Hospital.
Wonderful.
In fact, an interesting point is that we now have nearly 70% of all the providers that are seen here are dual credentialed, both at Dartmouth Hitchcock and at New London Hospital, where they split their time.
Terrific. So, and I know you have some new providers coming. We're going to learn more about that in our next interview. Thanks so much for your time.
Oh, thank you, Lynn.